Okay, hi everyone. So I know that there was some difficulties with you guys being able to unmute yourself or ask questions in the chat. So if you have a question throughout this and you can't do that, raise your hand and we'll make sure to that you can contribute. So for today's agenda, we're going to be introducing the new face-to-face checklist. And while we're introducing it, we're going to talk about the settings rule and how each item is related with ongoing compliance. We'll also go into each question on the checklist in more detail. So we'll introduce the checklist, kind of go over the settings with it, talk about how New Choices waiver is affected with it, what is ongoing compliance, what have we been doing, and then we'll make sure to go through each item in depth for you. Okay, so this is our new face-to-face checklist. So Marisol kind of mentioned it's been a big collaboration with the New Choices Waiver CMA work group. So I just want to start by giving a really big shout out to them. It was something when we were like, okay, we got to get this in place. What's the best way to do it? And we got great feedback. So I appreciate that. So I want to start off by acknowledging the hard work that you guys are already doing every day. It might not seem like the best time to implement a new checklist or procedure, but as you know, with the settings rule, we have to be compliant. And so that's why we're doing this now. So we just don't want to seem insensitive to the amount of work you have already. Okay, so I'm going to show you the entire checklist with going through slides and then explaining all of them, but this is just a little preview of it. So we've talked about the settings rule before, and hopefully after today, you guys have a better understanding of what it is and how it relates to you guys and our participants. The HCBS settings requirements for the home and community-based settings final rule. It's a federal rule that governs where and how services are provided to individuals receiving services under the Medicaid home and community-based waivers. So the rule is governed by the Centers for Medicare and Medicaid Services. So all services that fall under a Medicaid home and community-based waiver have to comply with this rule. So for New Choices waiver, adult day health, and then residential services are the main focus. All other services are currently considered compliant under the rule. So when we're talking about compliance, we're focusing on adult residential services, our assisted livings and independent living centers, and then adult day health. Okay, so settings rule philosophy. So the settings rule is not just about regulation and compliance and checking boxes all day. The philosophy behind the rule is really about a change of mindset to person-centered services in regards to policies, processes, values, norms, programming, and everyday practices. It's a system change in how people are treated and the way things work. So that's just important to remember. There's philosophy behind the rule, not just like certain items we all have to meet. Okay, so compliance so far. So New Choices Waiver has worked with existing and new providers for years now to be compliant, and it's been a work in process. It's been a learning curve for providers as well as New Choices Waiver and even our QA team. So we've reviewed policy documents, lease agreements, resident handbooks. We interview the admins, owners, staff, and individuals to determine compliance for a setting. So we're now doing in-person site visits. They're pulled at random by our QA team every year. And so we'll go out monthly or so, and we're doing in-person visits at facilities to determine compliance. We are working on our New Choices Waiver policies and procedures to be in compliance. Like Marisol said, we haven't updated a lot of our main policies that need to be changed, and it's just because that's a big project and where it's always a work in process. So there might be some things that might seem a little conflicting, and there's usually gray language included in that to be able to include the settings rule. So like I said, let's just be kind to everyone by remembering this is a work in progress and we're all still learning how to be compliant. Okay, What does this mean for case managers? Probably a big question you've all had. How does this affect you? So case managers will be essential for ongoing monitoring and settings compliance, because you as case managers are the people with the boots on the ground in the field and the eyes and ears that actually see things that are going on that our office doesn't see. So New Choices Waiver needs to have a procedure or a policy in place to show settings ongoing compliance. There are also things in our state implementation plan with CMS that need performance metrics met by. So all of this going on, we brought it to the CMA work group to see how we can best implement something. And that's kind of how we came up with the checklist and the items on it. So we're just trying, the whole intention behind the checklist is just to be more compliant with the SIP policy and the settings rule. And again, a big shout out to the work group. If you guys aren't in the work group and you're interested in providing feedback, just reach out to us or me and we can get you involved. It's a great group and I'm very thankful for it. Okay, so before we go into each item on the checklist, are there any questions that we need to address right now? Okay, I'm gonna move on. Okay, so the first section of the face-to-face checklist is settings quarterly review. So this means these are the items that need to be addressed at each face-to-face visit, which is minimally 4 times a year. So these items are, and I hope you can see them okay, but the residential setting offers community outings and activities. The individual has the freedom and support to control their daily schedules and activities. For example, can help with own ADLs, outings, and eating meals. And the individual has access to food anytime without the assistance of staff. For example, a snack basket provided by the facility. So the first one, the setting offers community outings and activities. A big or main focus of the settings rule is community inclusion and ensuring that individuals are accessing the community to the extent they desire. So what does this mean? It means we're looking for the facility to be facilitating regular community outings, which would be going to the store, community events, restaurants, senior centers, things like that. And that the facility encourages and facilitates transportation options. This could be a bus that they have, or if they're encouraging using UTA or Uber, and helping assist them with that. Are there questions about this checklist with community outings? Stacy.
So my question about this is some of the smaller home-like facilities that don't have buses and the clients can't afford Ubers. For most of them, what we've typically done is add non-medical transportation and attendant care, and then we're checking with the client monthly, or you have any problems accessing that. Would that be in line with the settings rule, even though we're the one facilitating it, but the client is still able to access the community as much as they desire? Would we be able to mark yes on that, even though the facility doesn't do any out of building activities? We're the ones providing that because we know it's a deficit.
Yeah, great question. So we did run into a couple facilities that don't have their own transportation and don't really do things out of the facility. So what we've kind of determined for compliance for them is we expect them to have some kind of transportation options presented to individuals. This could be a flyer that says, hey, if you want help using UTA or Uber, or if you want help getting non-medical transportation, like you said. And then as also for community outings and stuff, we would expect them to have some kind of board that is showing what's going on in the community and like giving options of what they could go do. And then saying, like, if you need help finding a bus route or finding a ride, contact us so we can help with your case manager. So we're kind of looking for them to just put something out there to encourage that, and that they can help step in and close the gap of finding somebody or UTA or something to help transport them. Does that make sense?
Yeah, it makes sense. It's just, that'll be an interesting one for those smaller facilities, because that's always something we've typically done as a case manager to bridge that gap.
Well, and part of that expectation is that they get a hold of you to help bridge that gap. So they're like, okay, yeah, we told you about this event and you want to go. Let's talk with your case manager about getting services to get you out there. Instead of them just being like, we don't even talk about the outside community.
Okay, so if it's well known there that they are helpful and they call us all the time, if the client wants to go out, we can mark that as a yes. Okay.
Yep. As long as they're getting out to the extent they desire and they're happy, then we're good.
Okay, thank you.
Wendy?
I just want to point out and get some clarification. I was reading that advocate's guide that I believe Marisol sent out to us, and they were talking about the settings rule when it comes to food, and they said that snack baskets are not enough. So I don't know if that is just I'm just saying that's what it says in this guide. That's going to come forward in January with CMS.
Yeah.
The other part I had was some of these buildings are large enough that they have commercial licenses for their kitchens. And if we allow patients to go or clients to go in there and utilize the kitchen, doesn't that interfere with their licensing from the health department?
Yeah, so we'll touch more on the food in a second. As far as the kitchen access, which we will talk about later too, what is expected is that they can have access to a microwave or a toaster or a fridge, something that they can prepare a meal for. So if they have a microwave in their room, or if there's one in the common area that they can utilize, that's compliant. We don't expect them to let everybody use the kitchen, but if it's like, sometimes there's smaller facilities that don't have a microwave everyone can access or anything, then in that instance they would need to be able to use like the microwave in the kitchen. But that's the expectation, is that there's something they can use to prepare food if they'd like. Okay, I'm gonna
there's a couple chat questions related to transportation.
Okay. All right. So secure memory units. So memory care individuals, we do follow their memory care checklist and whatever was in place for them accessing the community. We do still expect them to facilitate outings, and not just because they're in the memory care facility doesn't mean they can't go out. So if they're going out with staff to go out and things like that, but there is the health and safety concern with memory care where if they need their representative or somebody else there, then that is acceptable. Certain facilities have a policy that if a client is on the waiver, they expect to use mode of care rather than their bus, MBK, for example. Facilities cannot, they can't say what provider they can use. So if they have a policy like that in place, if you want to send it to us, well, I'll talk about how you can send concerns to us near the end. But if they're saying you can only use this provider, that's a freedom of choice concern. Just like they can't say you only use this CMA. So that wouldn't be acceptable. Okay. I'm gonna move on unless you guys want to flag me. Okay, so it's important to know the difference between community integration and reverse integration. We found that when working with providers, community is often referred to residents within the building, like they have their own community in there, which is great, and we obviously encourage that. But when we're talking about community, it's the greater community, so it's outside of the facility, parks, stores, restaurants, things like that. So reverse integration involves bringing people and activities from the broader community into the setting. So that's like having someone from church come into the setting, which is great, but they need to also offer them to be able to go out of the setting and go to a church themselves instead of supporting people in setting accessing. So reverse integration activities are not sufficient to meet the true intent and the spirit of the HCBS settings rule. We've talked with facilities about this where they'll be like, oh, we have people come in all the time. That's great. Obviously, we're happy with that, but they need to also facilitate individuals and residents accessing the community by going outside and going to these activities just as you and I would. True community integration involves accessing the broader community outside of the facility or day health setting and interacting with members of the community. What interacting can be, is simple greetings, purchasing their own items themselves, ordering their own meals, just talking with people instead of staff doing that for them. Okay. So the next question on the checklist was, the individual has the freedom and support to control their daily schedules and activities. This is help with ADLs, outings, and eating meals. The focus for this one is that if they want to skip or change their shower time, they can. They're not being forced to shower. They can eat their meal in their room if they would like. There's no assigned seating. They can sit wherever they want. There's no forcing them to do a certain activity, and that they can offer feedback and activities and schedules. So that's just kind of, they're not being told everything they have to do every day, but they can give feedback and they have a choice in things. Any questions? So yes, so if they're sick, so they are able to charge for like room service essentially, but they can't charge them if the individual goes to get their own food and brings it back to their room. They can't charge them for that, but they are allowed to charge for room service essentially. Oh, unless they are sick. Okay, good. Yeah, I hope that clears that up. So they can charge for room service, but the individual has the freedom to go get their own meal and eat it wherever they'd like. Okay.
Real quick, I'm just going to clarify, when it comes to extra charges, we also want to make sure that there's equality between new choice waiver participants and non-new choice waiver participants at the facility. So if they're charging new choice waiver participants for something that they wouldn't charge everyone else at the facility, whether that's delivering food or anything else, then that would be something we'd want you to report as well.
Yeah, thank you, Kendra. So the emphasis is that they're treated the same as private pay individuals. Okay, can the individual access food anytime without the assistance of staff? So individuals need to be able to access food at any time without asking staff. We have worked with providers to have a snack basket or snacks in the fridge that they can independently access without asking for help. Wendy's comment earlier about a basket not being sufficient. We do make them have like a variety of snacks, so they can't just put out a bag of chips. They need to be able to show us that they're offering a variety of snacks. So they might have some sandwiches and stuff in the fridge and then some snacks on the counter they can access. We don't just call it compliant if there's like one snack option out there. Does that make more sense, Wendy? Does that answer that question?
Yes, thank you.
Okay, awesome. And then they need to be able to have access to a microwave or kitchen appliances if they'd like to make their own meal. We kind of touched on that earlier. Can they charge for snacks? No, that is included in their rate to provide meals, and in the assisted living rule, it does say that they have to provide snacks. If they're saying they can't go in the kitchen, then they need to be able to provide them with a kitchenette in their own room, a microwave and a fridge or something in a common area that they can access. Sam?
So at one point when this was first rolling out, we had a building told that if our client wants to go in and make chocolate chip cookies at 3 a.m., they can do that. And the facility, first of all, their concern was safety, but also, if they use all the eggs and all the flour, they can't make breakfast. So I just want to clarify that that is no longer the expectation, even though that's what the facility was told.
I mean, I would say if the individual wants to bake cookies and they don't have a stove otherwise, I think what we would expect is that they would facilitate that to be done at a decent time, not during meals or in the middle of the night, and that staff would make sure the kitchen is open and safe for them so that they can independently do so. If they want to prepare their own meal that's not on the menu or something, they need to use their own supplies, just as you and I would if we were living there and we wanted to make cookies. In a sense, we would need to bring the supplies ourselves. So if somebody wants to make a certain soup for everybody that they love to make, it's not on the facility to provide those ingredients, it's on the individual. Okay. All right. Are we able to use waiver funds to purchase? No. That needs to be a part of the facility. If they don't have one in their room already, they need to have some kind of cooking appliance available for them. Marisol?
Riley, would you mind just saying the question out loud?
Oh, sorry. Yeah, that's a good question. Yes, so no, they can't. We can't use waiver funds to purchase a microwave for participants who don't have the ability to purchase. The facility needs to be able to provide some kind of cooking appliance. My concern is that these residents don't have food handlers permits and that there's a licensing room for facility example. So that as long, if they're not they are not cooking the meals that the facility is supposed to provide. If they're just making something personally for them, then they should be allowed to do so. But again, we don't expect them to let them do it mid-breakfast preparation or anything, but to schedule a time to be like, hey, I want to make some cookies. When's a good time I can do this for the kitchen so that it's available?
And for a little bit of clarification with a lot of these questions that are arising around what about health facility licensing, we are working and coordinating with health facility licensing on the back end. There is a policy that says if there is any conflict between health facility licensing and the settings rule does take precedence. And ultimately, if you guys have a concern or see something that might be in conflict, feel free to reach out to us. We're not expecting you guys to know everything. And just let us know and we can follow up as needed.
Yeah. So Brianne, that no facilities are going to allow this. We've talked with facilities many times about this and how to make it work if someone wants to do so. So if there's a concern, like Kendra said, let us know and we can help navigate it. However, what if they need assistance with this but still want to bake or make food? Does this fall in the facility or do we need to set up an attendant care person for this? I don't know. Marisol, what do you think?
Research into policy. I don't see our being able to support attendant care within the assisted living facility, but I'll have to do some research with policy.
Yeah, we'll clarify on that. That's a good question. Sorry, hold on. Let me find that question. Can a facility demand that residents purchase their own toilet paper? Is that included in what we provide, Marisol, Kendra? Do you know?
Yes, that should be included according to HFL.
Okay, yes. So no, they cannot ask them to purchase it. Can they have offered snacks in a basket, but then extra snacks for purchase? No. Well, I don't understand. What do you mean? Like a vending machine? Do you have an example, Kara? Marisol.
So I can,
Go ahead.
for as far as the pay and non-pay snacks, what we're looking for is to make sure that they have a variety of snacks that they can access independently. If they also have separate snacks elsewhere, like a vending machine that the participant would have to pay for, then most likely it probably is okay. But if you have concerns with how it's being handled, you can let us know.
We're going to research the toilet papering concern and then we'll send out what's going on with that because I think we need to dive into that if this is an issue multiple case managers are having. So we'll follow up on that and send it out for you. Okay. So the next section is settings annual review. So these are items that might not change as often as the ones we just discussed. So we only need them to be reviewed annually or if there's a new move that happens. So if they go to a new facility. And really quick, Anissa, I do think they can have them purchase their own shampoo, conditioner, and soap, but I think toilet paper is not. So, okay. So moving on. So the first thing on here is individuals may have visitors at any time, including overnight visitors, and we'll dive more into that in a second. Setting is physically accessible to the individual. Individual has privacy in their sleeping or living unit. The individual's room has a working lock. The individual's bathroom has a working lock. The individual has a choice in their roommate. And the individual has the freedom to furnish and decorate their sleeping and or living units. So let's get into each of these because I'm sure there's some questions. So individuals may have visitors at any time, including overnight. The idea behind this is that they can have visitors in their home just as you and I can. If we want to have an overnight visitor, we can, so they can as well. The facility cannot require permission prior to having visitors stay overnight, and they cannot require a sign-in for guests. We have worked with providers that they can encourage a sign-in, and they can encourage them to tell them, excuse me, if they have a guest overnight, but it cannot be a requirement. So that there's nothing, they can't deny guests. There's a lot of concerns with providers about someone living at the facility with the resident by saying they're a guest. So there are Utah landlord tenant laws that prevent that. And we refer to them frequently without quoting it directly. Sorry, I probably should have for this. I believe it's 7 consecutive days overnight that technically is in the landlord tenant law that they can say that that's not allowed. So again, this is one that we would expect to be reviewed annually, or if they move to a new facility. No permission required, no visiting hours posted. So if there's no visiting hours posted, but if they lock their doors at night when the office is closed, they just need to have some kind of phone number or a doorbell they can push to be let in. Okay, let's look at some of these questions. Many facilities deny overnight visitors. It has sometimes led to staying too long, causing problems. So like I said, this is something too, an example of what's called like a blanket restriction. We'll kind of talk about that later too. But just because one individual caused an issue or a disruption doesn't mean that everybody now has to obey a rule. So that's why when we review policies and there's something about overnight visitors, we tell facilities they have to take it out and they have to allow overnight visitors. And that if they have concerns, they can refer to the Utah landlord tenant laws. But yes, we are moving a resident into a new facility and we were told they could not have a power scooter or chair and that they could only use their walker or a manual chair. No, they cannot restrict what items they have. That's discrimination. Some facilities have like a policy about power chairs and stuff, and we've looked at those to make sure it's not too restricting. Usually it involves almost like a safety deposit or something because there's so much damage that can happen from them, but they can't deny the use of those. If there's an issue with the visitor and the facility says that they're not allowed on the property anymore, would that still be compliant? They would need to have just legitimate reasons. If they're a threat to the facility and other people, if they do like a restraining order and there's police involved in stuff, like those things are legitimate. Like if they're doing illegal activities on the facility, yes, they can say that they can't come to the facility anymore, or if they pose a threat to other residents, for example. Is New Choices Waiver going to make sure that AOs get this information coming from you at this state means a lot more than us from CMs. We have been working with them. So there's a lot of facilities and only so many of us. So we have been working with them. If they do a change of ownership or are a new provider that come through. And then now during ongoing compliance, what's happening is as we go out to meet with them, if we find these issues, we're providing that education there and how they can fix it. We haven't done any like statewide training or anything for facilities. There is training that's posted on the website. And we just updated the slides, so it will be posted soon enough. I don't know when, but it's through the QA team that's working on that. So that will be provided for facilities, and then during ongoing compliance, like our team will be going out and meeting with them to talk about these items. They should be pretty aware of the settings rule by now. They're just not, the specifics are hard to navigate. And it's a big, like we said, it's a big philosophy change. Okay. How does this apply to Uber Eats or DoorDash? I have seen a facility throw away a consumer's food because it was passed. Absolutely not. They can't have visiting hours, and no. So they can't have visiting hours posted. And if an individual wants to order DoorDash or food, they need to have a way where they can push a doorbell so that then an aide can come answer the door, or the individual can, or a phone number that they can call to do it. That is disappointing to hear. Would not allowing motorized wheelchairs in and out be a blanket restriction? Yes. Can the facility charge for overnight visitors if they do this across all boards to all residents? They cannot charge for overnight visitors. They can charge for guest meals. That's acceptable, but they cannot charge for overnight visitors. And like I said, to avoid family moving into their room, they can refer to Utah landlord-tenant laws of how they can enforce that. Can they make them pay to use a power chair in the facility? Their own power chair, no. Sometimes they might have like a safety deposit related to it, but that's all. Some facilities say these are our rules, which go against many other things we've talked about today. If you can't comply, then choose a different facility. Is that appropriate? No. If they are receiving HCBS waiver funds, they need to comply with the settings rule. So no. You mentioned that the settings rule supersedes other policies. So does that mean that the landlord-tenant law supersedes the settings rule? It could, but we are kind of leaning towards the landlord-tenant laws because individuals not receiving services would also be under landlord-tenant laws if they were like in private living areas and stuff. So that's why we kind of refer to that.
Right.
Yeah.
Technically, the settings rule, because it's federally mandated, does supersede over state laws. So if it's a federal sort of law, then that's where, you know, that would supersede other laws.
Yeah, but where Utah, the state team has kind of chosen to lean with the Utah landlord-tenant laws as far as compliance. We're excited to do visits too. Locked bathroom question. If the resident's family took the bathroom door off to make it easier for client to access their own client choice, they have a lock on their bedroom door, but no bathroom door at their own choice for independence. That's fine, but the facility needs to be able to show that they have locks, and if a new person moves in, that they are going to be able to provide the lock for them and the door for them.
And ultimately, it is the participant's decision. So as long as the family member didn't take the door off without consent from the participant.
Yeah, but the facility does have to initially provide the locked door, regardless. If they're moving in and saying, I don't want that, they need to have the locked door. And then if they want to remove it after, that's fine. We don't want facilities to just be like, you don't want a locked door on your bathroom, right? And then it just not ever happening. I think that a power chair deposit would violate fair housing, wouldn't it? You're charging someone for having electronic legs. We can look into that more. I'm not sure right now. I have a client with advanced dementia who keeps locking himself in the bathroom. It's a safety issue. Can his POA consent to removing the lock? He could, but we usually advise that staff just have a master key for those instances when it happens. And maybe perhaps he could have like a call light or something in the restroom to help with those instances. We have facilities that have a no power chair rule. We're going to look into this a little more because it seems like a bigger one too that's concerning as far as charging them or not allowing it. So we'll flag that and follow up with you guys. Okay. Setting is physically accessible to the individual. So again, this is one that you just need to review annually or upon a move. Pretty straightforward. They just need to be able to access all parts of their living environments, and any required assistance such as ramps, handrails, elevators are in place. as a follow-up to that, if you don't like it, you can choose a different facility. I am hearing that more and more. The assisted living facility themselves are saying that they are just going to stop taking new choices waiver. Placement is already beyond difficult. This is very concerning. We understand that there is a lot of concerns with this. And we just, if they want to be a provider, then they have to follow the rule. And there's not much we can do. We don't have any leeway with the settings rule. And if they don't want to be a provider, that's their choice, but we are working with them. We will work on them. We've had countless meetings with providers one-on-one to work through different policies and changes and how it can work with them. So we are happy to provide as much assistance as needed. And then Marisol did see that there is no regulation requiring the facility to provide the participant with toilet paper. So that's interesting. So today we all learned. Okay. The individual has privacy in their sleeping and or living unit. So again, this is one that's reviewed annually or upon a move. They're able to shut their door and be alone if they want. And there's no cameras in the common living areas. So in general, individuals do have privacy in their rooms and living units. The main focus of privacy in this aspect is cameras. A lot of adult residential services have had cameras in their dining rooms, hallways, etc. We've had to limit what is allowed to ensure individuals' privacy in their living areas, which would be dining rooms and common areas. So because cameras is a big commonly asked questions for providers, there's a flyer that we will send out with the training for you guys that maybe can help you. It's also on the website that you can find it. But to be able to, to be able to ensure individuals' rights to privacy, dignity, and respect, the following surveillance equipment generally do not raise privacy concerns and are allowed in any choice waiver settings. These are ones that are in areas dedicated to provider staff, so just desks or offices, monitoring entrances and exits, monitoring exterior areas of the building, such as a parking lot, and in commercial integrated areas of the settings. This is if they have a public store or a public cafe, for example. So I just want to say monitoring entrances and exits, we've had a lot of camera views submitted that also include seating and stuff that's near the door. We do ask that it be like zoomed in or repositioned to only have the door. So if an individual is sitting there, they're not recorded. So that's kind of the focus on that. Are clients allowed to lock their doors in their room? Yes, that is the big thing, that they're allowed to lock their doors. Okay. Do we have questions on cameras before moving on? We're going to talk more about locks in a second. Okay. Individuals' rooms have working locks on both the room and bathroom doors. So this is one that, again, is reviewed annually, or if they move to a new facility. The individual can open and close their doors, and they can operate the lock and the door on both the bathroom and the room themselves. So this is just that it's not a lock that they physically can't use. So we would expect that there's some kind of accommodation made so that they can open and close their door and lock their door and their bathroom door themselves. Questions about locks before moving on? Okay. Are clients able to have cameras in their room? Yes. So if it is a camera that is from the family, it's the family monitoring them or whatever, and the individual is consents to that, then that is fine. The facility cannot monitor them, so the facility can't have their cameras there, but if the individual and the family want a camera, that's fine. Okay. Individuals have a choice in their roommate. So we have heard a lot of confusion with this because there's a lot of individuals right now that can't afford a private room. So this is not related to that. So the individuals having a choice in their roommate doesn't have anything to do with if they can't afford a private room. It doesn't mean that the landlord has to provide a private room. It just means that if they're choosing to live with a roommate, they're able to meet them and choose from different individuals. And if they don't want to live with them, they don't have to. They can go to another facility. But just as if you and I couldn't afford a private apartment, they're not required to give us one. But we would be able to choose who we decide to live with. So they are not assigned a roommate, but they can meet them and have a choice if they want to live with them or not. That's kind of the big thing. Questions here? Sam?
So am I understanding correctly that, let's say I've got a guy who doesn't like his roommate, the facility has no other options for him. They are not required to play a shell game and make everyone else unhappy. They have the right to say, this is what we can offer you. If you don't like this roommate, you're welcome to move elsewhere.
Correct, yes. Okay. So individuals have the freedom to furnish and decorate their sleeping and or living units. So again, this is one annually or upon move. And they are able to choose their own furniture if they want. They can hang decor on the walls if they want, and they don't need to ask permission prior to doing so. So that's that. We've had some people be like, oh, we need to approve what they're going to hang on the walls first. Just as if you and I were in an apartment, the landlord doesn't need to approve what I'm hanging on the walls. So the same goes for them. Questions? Okay, so the last ones we did, so there was the quarterly one and then the annual one. What is expected is on the annual one, if it's just your normal face-to-face visit and you've already done it that year, you just skip over that section. You don't need to worry about it. Was there a question that I missed?
Yeah, sorry, I had a question.
Yeah.
We had a client who wanted to put up some suggestive things on their wall, we'll say. And the staff was worried about like CNAs coming in and help. And like, is there any kind of, I don't know, boundaries they can have with that kind of stuff? Like they can keep it in their drawer or they can just like post it on their wall for everyone to see.
Like a poster or something, right?
Yeah, posters, pictures, things like that.
Nope, they are allowed to have whatever they'd like in their rooms.
Okay.
Yeah. I know there, and if you run into an incident that's you're having a lot of trouble with the staff and facility, reach out to us and we'll help navigate it. Can they require how it is attached to the wall, such as no nails or need to use command strips, etc.? Kendra, I'm going to have you verify, but I think they can say, like, right?
I would imagine we wouldn't want destruction of the property.
Yeah. And I think I've seen like some landlords and stuff that say like, oh, use these kinds and stuff. So I believe so. And if I'm wrong, we'll correct it. Sam?
Back on Jacqueline's question, 99% of the time I totally support the having whatever decorations they want. But I have had instances over the years of gentlemen and sometimes ladies that have pictures that, I mean, and I'm pretty liberal on this, but I would consider soft porn. And it is in the argument that the facilities make is that it's in violation of the rights of the other residents, that if you open the door and there is a like I said, I am not super conservative on this. And I would say it's not fair to little old ladies walking down the hall to have to look at soft porn. So can there be restrictions about saying if you're going to put that up, let's put it around the corner, let's keep your door closed, let's put it behind the door, that sort of encouragement, because the other residents have rights too.
Yes. So I think the emphasis here is it's their private living area. So they cannot restrict what they hang on their walls. If you want to have a conversation with them and say, hey, this seems to be causing a little bit of, issues. What do you think about just hanging it here or there? But if they say, no, I want it right there, then that's where it goes. But you can encourage them to, reduce conflict and stuff by saying, it might be better over here. That's great. But you just can't say, no, it can't be here. So staff have no rights. Nope. They staff don't have rights to restrict or control how somebody lives and what they put in their room. Just because there's something hung on the wall that a staff may not like, doesn't mean they have a right to say that the individual can't have that. It's about the individual's rights in this situation. Yes, Wendy, I learned recently that clients can keep weapons in their room. That's correct. That's a big thing. I don't want that to spiral right now. If you guys have individual situations you want to work on, we can. That is a hard topic, and it's a big one that we're working with facilities and individuals on, and sometimes scary. And so those are individualized. If participants are allowed to decorate how they wish to, participants have the right to refuse housekeeping or have an excessive amount of personal items kept in the room. They do have the right to refuse housekeeping and have things in their room, but there is a certain standard with health facility licensing as well as the fire marshal code if there is too many things in the room. Can we get a copy of the detailed settings policy so we can check on research some of these specific situations? So the actual settings rule, federal settings rule, we are happy to send it to you, but it is not an easy read. And a lot of the items in there were left to states' discretion of how to implement it. So for example, individuals need to have privacy in their living areas. We were like, obviously that means locks and not being monitored in their living areas. So the federal settings policy might not specifically say that they can't have a camera on them while they're eating, but being able to have privacy in their living areas implies that. And so that's what we've implemented. But I'm
adding the chat for you guys to reference. It is the Utah Department of Health and Human Services HCBS Settings Rule Transition Planning website. This has been in existence since the settings rule was initially implemented. And in that, there is a section of resources, including the information regarding the federal rule and what it entails, and the CMS resources. We can send you some more stuff later, but if you guys immediately want to look at that, that's been available and is still available at that website.
Yeah, thanks, Kendra. Wendy?
Actually, I was going to say the same thing that Kendra just said. I've used that website a lot. It's got some great flyers. I even believe there's a PowerPoint presentation there regarding the settings rule. So it is a good resource.
Yes, I will comment the PowerPoint on there right now is the one that we've recently updated, and it's being finalized to put on. It'll be a much easier read when it's updated for you. Right now, it's kind of a hard presentation to read, but there is good information in it. Okay. So then we have a risk factors and modifications section. So the items here are there any risk factors that need to be reviewed? Are there any modifications that need to be reviewed? If yes, does the individual still consent to the risk factor or modification plan? Are new supports or interventions needed? So I do want to touch really quick on just the yes, no, and then like yes, and this has been added to the PCCP. We've intentionally tailored each of these, like yes, list risk factor and list modification, and instructed to like add to the PCCP. We've kind of done that with some of the input with the work group too, of how to make it best for you guys. We'll talk more about like answering the questions later on, but just those are some things to pay attention to because they were purposely tailored, I guess. Okay. Risk factors and modifications. So for risk factors and modifications, it might not need to be reviewed at each face-to-face visit, but it could be. So that's why we're kind of leaving it to your discretion. Please note that if there is a risk factor or modification that needs to be reviewed, it says to list it. So don't just check list yes and leave it blank. You'll want to check yes and say memory care, frequent falls, alcohol, whatever it may be. The question asking if the individual still consents might be a little bit of a new one for us. If an individual, for example, wants help monitoring their drinking, they can have a plan in place that says staff will help them drink 1 glass a day, but they need to have a written plan that states that they consent to it and that they understand they can void it at any time. So if they change their mind, they can drink all they want that day. But because New Choices Waiver doesn't allow rights restrictions when it comes to any possible support plans in place, it's the consent that needs to be documented. That's key. So if New Choices Waiver or CMS will do site visits years down, or I don't know if it's years actually, I don't know, for the settings role. If they come across a situation like this where it's clear that staff is helping monitor drinking or whatever else it might be, that they were able to pull a written plan out that says that has consent, that Riley consents to this and understands that she can void it at any time. I know there's probably some follow-up questions to this. Clients are allowed to have racial propaganda on walls. I have a seriously racist client who calls the CNA. So guidelines here for this specific situation that seems to be a bit of a health and safety risk. Facilities have the right to discharge individuals if it's not working out. If they've worked with them to try to get things to work and they're, you know, harassing staff or whatever, they have the right to issue a 30-day notice. But yes, they are allowed to have propaganda on their walls if they'd like, just as they could in their own private apartment outside of a facility. I would encourage some collaboration with, you know, trying to reduce those conflicts, but ultimately if it's just not a good fit because of the staff or the facility, they can issue a discharge. But we would expect you guys to be doing some kind of conflict resolution to help before that. A question in the work group was about risk and modifications for memory care clients. Does the client have to consent to this, or can we have the POA guardian consent? I think with memory care, we are good with the POA guardian consent if the individual is not able, not in a coherent state enough to provide consent for those situations. Who is responsible for creating the written safety plan, the ARS or CMA? I would say it's a collaboration. This isn't written out anywhere, guys, to give like a clear thing. But when we're going out doing visits, if we run into these, we're telling them this is what we expect. This is what you need to have. It's more of a care meeting that you guys need to have, you know, like some kind of person-centered risk care meeting that you're having and writing up this plan. You'll obviously want to save it in your thing too. We don't have, you know, we have the risk factors conversation tool that we put out that could help with this. The key is just making sure there's consent in it. Wendy?
So real quick, as I understood, you said that this is not going to be a requirement to turn in to the state.
Mm-hmm.
I was wondering, I've already created a health and safety document that my staff do when they go face to face. A lot of these questions are already in there, but not worded this way. If I incorporate these words into my own health and safety, would that be okay?
Wendy, let me go ahead and answer that one. So we're going to actually ask that you keep those and retain those within your files. It might be that we require those later on in an auditing process. If, for example, we see that there is a settings violation, we might request that you submit this information. So you're welcome to, if you want to, utilize this, and you can add additional questions, you know, at the bottom of the checklist as you see fit. But we would need these particular questions answered and retained within your system.
Thanks, Marisol.
Sure.
Okay.
Hey, Riley, I think you might have missed a question from Mary Allison around 11:03 a.m. I don't know if I caught it about participants having the right to refuse housekeeping.
Yes, we talked about that a little bit. So they do have the right to refuse, but there are certain things in place with health facility licensing as well as the fire marshal code that facilities can implement if they need be.
Okay, thanks.
Do we do these checklists per client or per facility? Per client. So and we'll talk more about this in a second, but really quick, So when you have your face-to-face visits that you guys do, we would expect this to be completed at that time and sent in. So it's per client because it's individualized. For example, are they accessing the community to the extent they desire? That's a very individualized question. So, okay. So what is a restriction? I wanted to kind of talk about this a little bit more. These are just some examples of what a restriction might be. Providers will sometimes put restrictions in place without realizing they are because they think it's keeping them safe. So we don't believe there's any providers that have any ill intent with restricting individuals, but we have seen things put in place with kind of an explanation of, well, it's because of this and they're doing so much better now. And I see it, understand, but we don't allow rights restrictions like that. So the only modification restriction that is allowed is memory care, which we have a process in place for that. And any kind of support plan or safety plan that is put in place for someone needs to be done with their consent and their involvement. So they need to kind of be the driver of that safety plan. And they can void it at any time, just like you and I could if we decided not to do something anymore. Just because they're receiving services doesn't mean that staff and providers can make these decisions for them. Do we have any questions? Okay. Can they charge for overnight visitors if this is a facility-wide dollar residence? No. They cannot charge overnight visitors. They can charge for meals for guests, but not overnight visitors. Okay, critical incidents. So this section saying, were there any critical incidents that occurred in the last 90 days? For example, injuries, hospitalizations, falls, etc. If yes, was this reported to New Choice's waiver? Yes, no, please initiate an incident report in PEGA. Were appropriate measures or other interventions successfully implemented and documented in your log notes? Yes, no. So these are things, there's some things on here that are very settings related and others that are more related to our state implementation plan with CMS as far as metrics. And this is one of them. This is something that we believe you guys are already doing at your face-to-face visits. So this is just documenting it. Questions? Can a facility restrict a client from having over-the-counter meds be stored in their own rooms? No, and this is one that we specifically do address with facilities, is that they're allowed to have Tylenol, ibuprofen, Tums, whatever they might want in their rooms. If the facility is concerned about like other individuals accessing them or something, we've talked to them about like they can provide some kind of lockbox as long as the individual can access that themselves independently. Okay. So critical instances. Yeah. So again, this is just things we've already gone over. And this is just kind of double checking that. I believe you guys are already doing this. So hopefully it's not more work for you. Okay. Care plan section. So I was told that it is state policy. Okay, hold on. I was always taught that DHL policy is all medications administered by facility. So this is one that we've worked with health facility licensing on recently. They will not be citing facilities for this. They might talk about it, but they are able to, they can reach out to us if they have concerns, and we've told facilities that, hey, if you guys are hearing this from health facility licensing, reach out to us, because as Marisol said before, it's a federal rule, and so it is over the state health facility licensing. Yep, so this was just recently resolved with health facility licensing that they are allowed to have their own over-the-counter medications. So if you have a facility who is hesitant of that because of health facility licensing, they can reach out to us for some confirmation on that. We recently had something where they won't be cited for this. because of the settings rule. Okay, care plan. Were services provided in accordance with the care plan for the past 90 days? Is the participant satisfied with their care plan? Are changes to the current care plan needed goals, services, supports? Wendy, the policy is being worked on with health facility licensing to be updated. It's an ongoing project between the settings rule and health facility licensing, but they're aware of it. Okay, so during your face-to-face visits, it's important to check in on the services and care plan and how it's been going. If the individual answers, if the individual answers no, that it hasn't been provided within the care plan, the answer we're looking for under please explain is going to be something like looking at a change for provider and attendant care. So kind of like a quick explanation in there of what's going on. So it's not just no, not happy, but like no, working on changing to a new provider as they're unsatisfied. So we're asking that it's just documented where the change be made. So it can be documented in the PCCP log notes, etc. You can say that like, are changes to the current care plan needed? Yes, documented in PCCP, updated on care plan. You don't have to say updated from Susie's to so-and-so. You can just say that it's been done. Questions on this part? I do want to get through everything, so I might kind of rush a little bit. Okay, community access. Was the participant able to access the community as desired? Are changes needed to support the community? So again, we've talked a lot about community access. And so same thing with these answers here. Were they able to access the community as desired? No, maybe they got sick, maybe they have an injury, or if it's because of, you know, a lack of staff or the provider not working out, then we would want that updated here. Like, yes, the change is being made with this. Or yes, they need a new walker or something. If you guys have big questions, flag me or put them in the chat and we'll try to address them as they come. Okay, level of care. Has the participant experienced substantial change in health status or inpatient stay in the last 90 days? If yes, was a health status screening submitted in PEGA, returned to community from inpatient or substantial change in health status case? So this one is focused from the state implementation plan that we're meeting this metric that the health status screenings are being timely when needed. So that's what this question is triggering, that it is being done. So we wanted to say health status screening, but also include the PEGA tasks as they're named in PEGA there for you. And yeah, I'm just repeating myself here. Okay, explaining answers. So we've kind of talked about this. If there was an issue or a finding in an audit that we would ask for this to be reviewed, we would want to be able to kind of understand what happened quickly or be able to know where to look to find that answer. So when it says, please explain after a yes or no question, just please, you know, kind of properly explain or summarize as short as you can without having to duplicate where you guys document everything. Answers such as interventions in place is not what we're looking for. We're looking for things that are like short and sweet, such as increased attendant care, spoke with admin on change, spoke with staff, fixed door lock, things like that. If there's a scenario that requires extra explanation, you can say, see log note dated 12/6/23, and then we would know where to go to reference that. The checklist is a way to kind of screen things and make sure we're addressing points, but also make sure there is a place for explanation if needed. So the idea is that if someone were to look at it and want to see where changes were made, we would know where to go or have that answer there. Okay, so this is to be completed minimally 4 times a year. And the intention is that it will be completed during your face-to-face visits that are required every 3 months. And one of those times can be during your annual meeting as well. So you don't need to do like 2 meetings during that. We're not creating new face-to-face visit really requirements. These are things except the settings details, but you guys are already kind of doing all of these things. So the settings annual section review can go into more detail. Again, those are only needed annually or if there's a new move. So we kind of purposely separated those items for you to try to reduce that work. It does not need to be submitted to New Choices waiver. It is required to be housed within your agency, and you only need to report findings to New Choices waiver office if there are concerns found that you need our assistance with. There are items such as care plan review, LOC, and critical incidents that have performance metrics within the state implementation plan. So this is how it will be monitored, the checklist during the CMA quarterly audits to ensure compliance. So we are planning on integrating that into the audits. And yeah, do you guys have questions? Is medical cannabis considered an over-the-counter medication that can be kept in the rooms, or are ALFs still able to manage as a controlled substance? I believe they're able to keep that in their rooms. If they're determined, yeah.
We can look into health facility licensing on that one as well.
Yeah. So again, reporting concerns, email us like you do, call us, whatever you need, and we'll make sure that we follow up appropriately. It'll get assigned to the right person. So if you just email our main inbox that you have a settings concern, we should be able to follow up. So again, settings resources, the link that Kendra provided earlier, we'll provide it in the slides as well. There's a lot of documents and handouts in there that can be helpful. Is the expectation for the CMAs as we fill out these forms to get the items not in compliance, or would we report to New Choices waiver? Just report to us. So if you find like, oh, the facility is not in compliance by this, if it's something small that you're like, oh, I can talk to him real quick and fix that, then, you know, go ahead and do that. But if it's something that you're like, this is a bigger issue, you send it to us, and we'll look into it. We'll talk with the provider. If we need your assistance, we'll reach out. But we don't expect you guys to be like implementing these changes with them. Just, yeah, it's our responsibility to have them come into compliance. So you can just notify us and we'll do it. But we don't want that weight on your shoulders. Like I said, you guys are like the eyes and ears out there. So you're just reporting to us essentially. That's the end of my explanation. So we just have questions now.
If anyone wants to raise their hand, typically it's easier to ask a question verbally.
Yeah, you can totally speak up if you want. Marisol, there's just concerns about being able to get the recording. Like she said, we really are like kind of not able to do that. But if you guys want to meet with me or to talk over it in more detail, just reach out. Stace, go ahead.
I'll look into it and we'll do what we can. It depends on Colin, essentially.
Okay, Stacy.
Okay, so I just wanted to go back to the power wheelchair thing and make sure you guys are going to get back to us, because what a lot of facilities are doing right now due to the damage being caused is they're charging an across the board, not just New Choice waiver, private pay clients too, like an extra $150 a month or an extra $3,000 security deposit if you want to have an electric wheelchair. So clients are kind of being told, this is our facility policy. It's kind of like the roommate thing. If you don't like it, we've got to find you another facility. Or even I had a facility a year ago, everybody across the board got a 5% increase on their rent annually. If you had an electric wheelchair, it was an 8% increase, whether you were New Choice waiver or private pay, because the state, when they came in and did their audit, dinged them for every mark and damage, including in the hallways, done by electric wheelchairs. And so this has become a focus of the state audits when they're coming into their facilities. So it's becoming a big focus of the facilities, if that makes sense, and not just our clients. everyone.
No, I totally see that. We'll dive into that a little more, and what it all entails. It's good to know. We didn't really realize this was as big of an issue as it is. Sharon?
So I just had a question on the visitor policy. I have a client who she's younger and she has custody of her 15-year-old child, or not, she has, partial custody. So he comes and visits her every other weekend, so 2 weekends a month. She's currently being evicted, so I'm trying to find a new place for her. Do I have to ask when I'm looking for facilities if they will allow him to come every other weekend, or is this just a no that they have to allow that?
Yeah, I believe they have to allow that. That's not going over the 7-day rule or anything with Utah landlord tenants. That needs to be accommodated.
Okay, thank you.
Yeah, thanks for asking. Wendy?
Going back to the wheelchair concerns, I do know that there's a provision in the Americans with Disability Act that prevents buildings from not allowing wheelchairs. And I've used that argument with several assisted livings and have won that argument because of the backing of the Americans with Disability Act.
Wendy, would you mind sending that over to us, please?
Yeah, you bet.
Thank you.
Our facilities allowed to refuse pets if a client already has a pet. I do think they're allowed to do that just as apartments can say like they don't allow pets or they do. Amy?
Question about over-the-counter medication. If a client is in memory care, do we just need to add that in like the risk and modification section that they will not have over-the-counter medications in their room?
No. So the key here is if somebody wants to have their over-the-counter medications, they can. But it doesn't have to if they've determined the facility to manage their medications, it doesn't need to be automatically assumed that they will have their over-the-counter, but if they want to, they can. Does that make more sense?
I mean, there are some people who are confused that it's like, yes, I want them to, because I have one client who wants to have the assisted living manage their medications, but then they also want their, their gummies or their over-the-counter medications in their room, which they're not safe with them.
Yeah. And we can, if we're specifically about the gummies and stuff, we can look into that more. But ultimately, if they want to have their over-the-counter medications, they're allowed to. I really hate to cut this off with everybody, but we've reached our time and we want to be respectful of everybody's time and day. But we